Hi there, it's Dr. Patricia. How are you? Thanks for joining us here on Facebook. Today is Thursday. It's Thrive Thursday, where I come to you live, either with my self-covering health topic or a guest to address your specific health concerns to help you step into your highest health. So thank you very much for joining. If you're joining live, please put in your name and where you're joining us from so we can say hi to you. And today I am super, super excited to have a longtime friend and also holistic health practitioner in this women's health space, Jessica Miller. Jessica, hi, thank you so much for joining us.
Hi, everyone. Thanks for having me, Patty.
Oh, my pleasure, Jessica. What I'm going to do is I'm going to introduce you. And I'm going to give a little bit of a background story to put this into context, because the topic for today is 5 reasons why your tongue posture could be causing your health to suffer. And for many people out there, that might be like a very unusual thing. Like a lot of people are in the health space and they're like, oh, I've never even thought about my tongue being a contributor to my health concerns, right? And you are a myofunctional therapist. Myo is muscle. Functional is like the appropriate movements of muscle, the optimal movements of muscle. And you're a therapist, which means you work on that muscle movement. And you are, in this case today, we're talking about the movements of the tongue, which is like such an interesting organ because it's one of our most mobile muscles in the body. It can go in like every direction. It can contract, it can squeeze, elongate, curve, curl, and it's rooted in our mouth, like in our head, and it actually attaches down into our neck. So such an interesting organ. And Jessica, is there anything you wanted to say before I launch into my story with the tongue and how it was contributing to my health issues?
Yeah, I would just maybe say that if you've never thought about your tongue as needing a posture or that there is a correct posture for your tongue, you're not alone. Most people have not thought about this. I've had a very long and winding history around this, and it's only been in the last couple of years that I've even realized the importance of this. So I'm very excited to bring this information to anybody who will listen. And yeah, I would love to hear some of your story, Patty, on how you came to this health journey.
Yeah. So the way my tongue presented itself as being an issue is in a way that wasn't really like thought of as being an issue in the beginning, which was I had a tongue tie. I was born with my tongue tied. So very restricted posture potential. And, in those days, and even now it's not that well understood, although way more now than before, but in those days it wasn't very understood. And I had a lot of hard times being breastfed by my mother. My mother could not breastfeed me well. And she went to the doctor couldn't figure it out. She had to eventually put me on formula because it just wasn't working with the breastfeeding. And so that's kind of how it started. And this is more like in retrospect. In retrospect, we recognize that that was probably a contributing factor, was that my tongue was tied. So what happened was when you breastfeed, right, you have to like have your tongue be able to come out to do the latch. And you'll get more into this, but I just couldn't latch. So I didn't have a strong enough latch to breastfeed.
Mm-hmm.
And then as I was a young girl growing up, I developed issues with like jaw, like a lot of tension in my jaw, a lot of grinding of my jaw, and a lot of tension like around here. And I would get like neck pain and kind of like headaches, like these tension headaches, right? And the thing is, nothing in our health is like one thing. It's always the rule of compounding effects. There's always like this plus that. However, I had worked on a lot of things to fix all of this stuff. Like I went to the dentist, I went to the orthodontist, I got a night guard, which basically became my chew toy.
Mm-hmm.
Right. And then I got and then I did my nutrients, like I topped up my nutrients again because I was depleted due to various issues from being on hormonal contraceptives and stress from moving from Brazil to Canada various times. So I topped up my magnesium. That really helped like my tension headaches. I did a lot of qigong, a lot of stretching, a lot of opening up, and I was still left with this residual like jaw tension, just a feeling of tension around the neck, particularly around like the back of the neck and around the jaw and the clenching and the grinding. I mean, I ground so hard, I would chew through my night guard and I cracked my back teeth.
Mhm.
So like it's pretty bad. I had to have that like filled in. And then it was you actually. You had gone through your own journey, which you can speak to, and you said, let me look at your tongue, right? And you're a registered massage therapist. You had done osteopathy training as well. You were very into like nutrition and holistic and all that kind of stuff. And you also weren't like finding all of the answers within that realm. So you had taken a dive into the tongue, which you cover, which I think you learn about a little bit in massage therapy, right? So there was like a sort of an introduction there, and you said, well, my friends call me Patty, and you're like, Patty, I think you have like a tongue tie, and that could be contributing to your issues. And then my kids had problems with breastfeeding. I couldn't breastfeed my kids past like 2 months. They started to get failure to thrive, and it was like they also had the tongue tie. And you said, well, why don't you explore this? So I did. I went and I worked with myofunctional therapists, myself and my kids. We actually both all recently got our tongue tie released. And we'll talk about that later, but I had the surgery to release the tongue tie, and so did my kids. And I realized that actually the surgery was like a minor part of it. A big part of it was re-educating the tongue on where it should go. And another thing that I linked into being it was mouth breathing. I was breathing with my mouth open at night, and that was like, this, if you wake up with like a really dry tongue and a really dry mouth.
Yeah. Or drool on your pillow.
Yeah. I didn't have that as much, but I noticed my kids did, like my 6-year-old and my 4-year-old, especially my 6-year-old. There was that, and it's like it was interesting to me because I would go into their bedroom and I would notice that they were breathing with their mouth open at night too. And I've learned so much about the ill effects of mouth breathing at night. It's like you need to breathe through your nose to oxygenate, to get the nitrogen oxide, to get like basically you better oxygenate your brain when you breathe through your nose, right? And a whole bunch of other things, but mouth breathing dries out the mouth, and you don't get the same like the nostrils were built to breathe through it. And if your tongue isn't in the right position, if it doesn't have the right posture, the right tone, the right functionality, it drops down and it opens your mouth up, so you breathe with your mouth open at night. And that's just one of many things. And very appropriately, your talk is saying 5 reasons why your tongue posture could be causing your health to suffer. So I think this is a good time for me to stop talking, for you to, share with us like your expertise and your journey, and kind of hone in on those 5 reasons, which I find so fascinating.
Yeah, thank you. And it sounds like you've got a really good comprehension of the topic. And you have to, when you've dug so deep already, and then have to walk through this path as well. So we've talked a lot about tongue posture. So I'll just quickly tell the listeners what proper tongue posture is. The tongue should be on the roof of the mouth, front to back, the whole thing, and it should not be touching any of the teeth. And so there's a if you say the letter N, the spot where your tongue touches on the roof of the mouth, that is where the front of your tongue should anchor, and then the rest of the tongue, front to back, should sort of suction up to the roof of your mouth. So I'm going to lean in and show you guys all my mouth a little bit up close and personal. So it should look like this. And then you close your mouth. So you suction the whole thing up. So that is what proper tongue posture is. And the thing is, when you don't have proper tongue posture, structure and function are so interrelated. So when we're little babies, it's the tongue that shapes the roof of our mouth and shapes our craniofacial development, so the way that our cranium grows. So if you don't have, I love this quote, the tongue is your palate expander, and the lips are your face's braces. So if you have your tongue on the roof of your mouth from the time that you begin swallowing, which I think is about 7 or 11 weeks in your utero, you are going to have the most beautiful craniofacial development. Your face will grow nice and wide enough to accommodate all of your teeth, and would likely not even need wisdom teeth surgery. So it's just so important to have that posture. And if we don't have the tongue on the roof of the mouth, number one reason how your health will begin to suffer is that you will begin to have postural changes. And so what I mean by that is there's this concept of head forward posture. Now we tend to sometimes think about head forward posture as like texting posture or just slouching. Your head goes forward, your shoulders round forward, you get a bit more of a curve in the back of your neck. And when you have that kind of posture, it's so hard for your body to maintain it. Your head becomes effectively way heavier for your body to hold up. So you start to get those postural changes, and that starts this reinforcing feedback loop where your posture just becomes even more difficult to support, and you end up getting a lot of the pains that you were talking about, Patty, where you get like the neck discomfort, you start to get tension, headaches. So postural health is not just the posture of your tongue, but the posture of your whole body gets affected. This can also lead to point number 2, which is TMJ pain. And that's different than other types of pain, different than even headaches or head, neck, and shoulder pain. When you start to get TMJ pain, your jaw will maybe be sore, maybe not be sore, but you might start choosing softer foods.
And can I just say something for people who don't know? TMJ is the
Yes.
temporomandibular joint.
Yeah.
So it's a joint that's right here. If you put actually you have to put your hand in your ears, but if you put your fingers right there and you open and you close, it's that joint there. So that's the jaw. When you get the jaw pain from temporomandibular joint or TMJ, it's right around that area.
Yeah, so TMJ dysfunction, and that joint looks kind of like, you can imagine, like many joints, they look sort of like this. And when you start to get head forward posture, what happens is that this hand here is the jawbone, the mandible, and this hand here is your upper palate, your maxilla. And what happens when you have head forward posture or poor tongue posture is that the mandible, the jaw, starts to slide out of that joint. And then you have disc problems and poor lining up of that joint. You might start to have clicking in your jaw when you open. You might, as it progresses, you might get a lock jaw. Either it locks open or it locks closed. All sorts of.
Yeah, I have that actually. So I have the jaw malalignment.
Mm-hmm.
It jogs over when I open. And if you were with me, you would hear it clicking on this side.
Yeah.
And I was really lucky that I never developed really bad jaw pain or jaw locking, but just that jaw deviation and the clicking, and then the tension of the muscles around it, like here and here. That's like my experience with temporomandibular joint dysfunction.
Yeah, interesting. My father has a hard time with his jaw locking open. For me, I had more of the experience that I would just avoid eating hard food. I tend to prefer eating smoothies and soups and just overly cooked foods. And I know that that's just perpetuating the problem. But when it hurts to eat, well, what are you going to do, right? You still need to eat. So now, tongue posture is not just a frivolous concept of like, oh, you need to have good posture. When we think about health holistically and from a systems perspective, we're coming to point 3 here, where tongue posture is important for our airway health. Airway is one of the most important systems. Like, if we're going to rank the systems in the body, airway is probably the most important, because is the only system that if it's not working, you can only survive for a couple minutes, right?
Yeah, if you can't breathe properly, you're in trouble.
Exactly. And so there's a really interesting area of research right now in that those who are airway focused and myofunctional focused are pursuing is measuring the airway and how it changes when you have your different tongue posture, different tongue mobility. And the super interesting thing they're finding is that it's very hard to it's a very hard measurement to take because the body compensates around airway so much. If you think about, if you've ever taken for a first aid course and you trying to perform CPR, when you're initiating air into somebody's system, you do a head tilt chin lift. So that effectively opens up someone's airway. And when you have head forward posture, that opens up your airway. So an airway to be viable needs 8 to 10 millimeters. And if your tongue is not on the roof of the mouth, it's a compensation so that your airway has that minimum 8 millimeters to 10 millimeters of space so that you can get oxygenation to your tissues. Now, there's other things that will close off your airway: enlarged tonsils, enlarged adenoids, allergies, pollution. I'm not saying that the tongue is the solution to everything, but it is such an important part for airway health.
And also, from what I understand, like when you do have the tongue up against the palate, the tongue is sitting there appropriately, expanding the palate so you get nice jaw development, so you can avoid the braces and the wisdom teeth. And then it forces you to breathe through your nose. And actually, when you breathe through your nose and you get that release of nitric oxide, it actually expands your nose and your tissues, creating a larger airway. And if you breathe through your mouth, you don't get that. So the airway starts to close in. And they've done studies where people who are like mouth breathing and don't breathe through their nose, after a couple of years, they just completely almost obliterate their nose airway. So when you go to work with someone who's been mouth breathing for a really long time, it's really hard at first for them to get back to breathing through their nose because it's just so atrophied. It's so like becomes such a small passageway when really it should be like so nice and wide open and like receiving the airflow so abundantly.
Exactly. And there's so many things that I could speak to that. But basically, if the tongue's not on the roof of your mouth, your roof of your mouth can end up growing with a high palate. So like a very rounded palate. And the roof of your mouth is the floor of your nose. And so if you don't have the right lateral growth or front to back growth in your jaw, another thing that happens to your nose, to your airway, is that you can develop a deviated septum. And so that means that, air will more easily go through one nostril and not the other. And so then if you have any other allergies, your nose becomes more easily blocked, and then you're more likely to breathe through your mouth, again, with that reinforcing negative feedback loop. And I heard about this case study. It was so interesting. This child had a very beautifully growing face. And by beautiful, I just mean it had great lateral dimension, great anterior posterior dimension. It was growing the way that it should be and healthfully. And then he got a pet gerbil or hamster, I'm not sure, that was put in his room. And they had that there for a year. And he was allergic to that animal. And in 1 year, his whole face structure changed from 1 year of not breathing through his nose. And so there are interventions that can happen, but I mean, the least invasive intervention is just to ensure healthy habits around breathing. So, which leads to point number 4, which is sleep disordered breathing. So there's this negative cascade in health that happens, and it starts with poor tongue posture or poor tone or poor mobility of the tongue. And then that can lead to, the postural changes, which can lead to local inflammation, tonsillar swelling, tonsillar enlargement, which makes it more difficult to breathe through the nose. And then that can lead to systemic inflammation. And there's so many disease processes that we know that get their roots in your body through systemic inflammation. And if this goes untreated for your entire life, it can lead to, sleep apnea, high blood pressure, stroke, heart disease, and diabetes. I mean, it's just, those are heavy hitters in health, right? And so if we can make that intervention start as early as possible in this negative cascade, well,
Makes a big difference. Yeah. I mean, it's never too late too. Like you want to catch it young in children because that's where often the issue starts to present. And I caught mine when I was 42, right? So, and I'm still going through the process and we'll talk about what that is. So for all of you who are listening, sometimes it's scary to be listening to this and being like, oh my God, I have this for my children, and you get a little bit just in despair and a little bit anxious. Just so you know, there are solutions to this. Right. I actually am undergoing this right now myself with me and my children. So we'll never give you a problem without a solution. I promise you that always.
Absolutely. And I feel the same way. And yeah, I've had a very interesting path, which has been really similar to Patty's, where just all the pain that I had in my head, neck, and shoulders. I would get a lot of headaches in the back of my head. And I noticed as soon as I started doing just the simplest exercise, which was suctioning my tongue to the roof of my mouth, that on its own helped relieve the pressure in the back of my head. So there's in a myofunctional therapy protocol, it's usually about a 12 weeks where you get so many different exercises on how you can move your tongue. It's very surprising how many different ways you can move your tongue, but really there's 4 main goals. And if you boil it down to those 4 main goals, it sounds very simple, and it is simple. So basically for healthy oral facial development, healthy development of our airway, we want to be breathing through our nose. We want to have our lips sealed. And that's all the time, all day, all night, except when we're talking, except when we're eating. And then we want to have healthy tongue posture and correct swallowing. Those are the 4 goals. And there's lots of ways that we can get there, but it's simple, really.
Yeah, it's interesting because when I started doing the exercises with my local myofunctional therapist, because you're a bit further away, and this one you can do over Zoom. I was lucky to have someone local especially with the kids, right? That was really helpful, and which you recommended actually. And we were doing the extras and I'm like, oh my goodness, like my suction was so weak. My ability to swallow properly was definitely like impaired. Like, yeah, I chew and I swallow my food, but when she was teaching me the correct way to do it, I could tell that it was an appropriate way, and that the way I had been doing it my whole life just wasn't the most optimal way to do it. And so working on those patterns, and what I'm finding the most challenging and which I'm most excited to get really nailed in is to do the lips closed and the mouth closed breathing at night, because right now I mouth tape. So I'm taping my mouth at night, and I did a little mini protocol that I came up myself to figure out, like, is that safe? You don't want to go into mouth taping without some guidance, because if you do have really blocked nostrils and you can't breathe through your nose, you don't want to like tape your mouth and go for it, right? So first you have to figure that out. And anyways, there's like a way to do it, and you can't, some people do just start mouth taping. And what I noticed is that when I was sleeping with my mouth closed at night, which with appropriate tongue exercises, I would like to be able to do that naturally, is that I would wake up the next morning and my energy was like, when they're like, is your energy like from 0 to 10, what's your energy? My energy was like 20. I was like, holy moly. And literally it was like within a couple of nights of sleeping that way, to the point where like I'm addicted to it in a good way. Like I know that if I don't tape my mouth at night, the next day is just my energy will be like an 8 out of 10, which is still pretty good. But I love that 20 out of 10 energy from the moment I get up at night to the moment I go to bed. And I don't hit that level of energy if I don't mouth tape. And I'm so excited for the day when myself and my kids can get to that point of like appropriate tongue strength and functionality and timing and posture where that just naturally does it, because I can't tape my kids' mouths,
Yeah.
right? And,
And
you know,
and it's tough because when you're sleeping, I mean, you don't have your conscious thought around, is my mouth open or closed? So the habits have to become so ingrained during the day that it just happens by default at night. Or when we all wake up in the night, even if we just rouse a little bit. If you can train your brain, and we all have the ability to train new pathways in our brain, but if you can train it so that the first thought you have when you rouse is my tongue on the roof of your mouth, my mouth, that's it goes a long way in helping retrain that subconscious pattern. But you can get there.
yeah. And it's so interesting because I found that in my mind is like, why does this happen, right? Like you can have poor tongue posture with or without tongue tie. Like it just so happened that the tongue tie for me was a big piece, but one of my kids actually doesn't have a big tongue tie, but he still has poor tongue posture. And I was reading this book called Breath, the science, the new science, the lost art of breathing. It's something like that. And he was talking about how if you go into like tribal cultures in other countries, from the moment the child is born, they do everything they can for the child to be with their mouth closed while, if they're not chewing or speaking, and especially while they're sleeping. So he speaks to the research that shows that the mothers would go and like pinch the child's lips while they were sleeping, or close their jaw, or during the day they would be in be with your mouth closed, and they would just always do everything they could in the early developmental years of the child's life to promote that mouth closed posture.
And if you have a baby, you can kind of just push up on this soft spot under the chin, like right there. And that helps get the tongue to the roof of the mouth in baby populations.
Ooh, that's a really good tip.
Yeah, and then you do this while they're sleeping, and then you open their mouth, and then you do that again. And that's like doing a myofunctional exercise for a baby. It creates the seal, and then it breaks the seal, creates the seal, and creates that habit.
Oh my gosh. And the other thing I just want to say, I want to get this in within our talk, is that I went with my children to a breastfeeding clinic, and they analyzed my kids for tongue tie, and they missed it. And what I learned from that afterwards is that there are some people who are just go so deep into a specific topic that you need to see those people, right? And so if you're having a problem with your child with breastfeeding, or open mouth breathing,
or if your kid needs braces, or if they constantly have their mouth open, if they get like, it looks like they've got bruising under their eyes, if they have restless sleep, if they move around in the bed, if they have to pee in the nighttime, if they suck their thumb, if they liked having soothers when they were kids, if they chew on pencils, I mean, the list goes on. These are all poor oral motor habits that indicate
benefit. Indicate there's a problem, and indicate that they would benefit from working with a myofunctional therapist such as yourself.
Yeah, or even just having a consultation to say, do you think that my kid would need this kind of work? Because there's a lot of overlapping scope of therapy. Sometimes it could be a speech, you might want to work with a speech pathologist, or an occupational therapist, or an ENT, or a myofunctional therapist, or a dentist. There's a lot of different health professions that can help with this, but myofunctional therapists are the one who will screen for these oral motor disorders, mobility problems with the tongue, face, or mouth.
Yeah, totally. It's a holistic circle of care. Like I'm involved with a myofunctional therapist and a dentist, right? And actually I did a session with an osteopath before and after my tongue release, which my nervous system after the tongue release is basically they cut that that piece of tissue underneath the tongue that restricts the tongue movement. And my nervous system was so like activated after the surgery, and I went to the osteopath, and she just like helped it calm down. Like I could feel my body calming down. So it was so lovely to have this like very holistic approach to my tongue posture. And I'm still going through the post surgery rehab, and so are my kids. And it is definitely a commitment. However, to be free of, to experience the freedom and the peace of mind of knowing that they are properly breathing through their nose and oxygenating their brains, properly developing their jaws, so I don't have to spend thousands of dollars in the future and time on braces, and knowing that they're going to have like, yeah, like the bruising underneath the eyes, that's just like insufficient deep quality sleep. And the peeing at night, one of the reasons you can pee at night is you don't go into that deep sleep that blocks your body's ability to block your peeing, basically. Like there's a chemical reaction there, but I'm not going to go deep into that. So my kids are still going through that, and it's getting better. I can tell as their tongue posture gets better, they would pee at night, and they would wake up at night to drink because their mouth was dry from the mouth breathing. And to have like, I can just see in the future when myself and them go to bed, our mouths are closed, we go deeply into deep sleep, we wake up in the next morning, we haven't gone up to pee in the middle of the night, we feel refreshed and energetic. Yeah. And our jaws are like really nice and wide and receptive of all of our teeth, including our wisdom teeth. That's my goal. That's why I'm doing all of this, right? Like,
it's preventative health at its finest, I think.
100%. So that was really great. Is there anything else? I don't know if we covered number 5.
Oh, 5. I think I lumped 4 and 5 together because I was talking about sleep disordered breathing, and then 5 was just the funnel towards disease. How this is it seems like such a small thing, tongue posture, tone, and mobility. But when we don't have that, the implications can be wide-reaching.
Yeah, and you know what? It's very under-recognized in the population because, for example, I used to work on the spinal cord injury unit, and after a certain level of spinal cord injury, like depending on how high the spinal cord injury is, you develop sleep disordered breathing. And because sometimes it's like very individual, we would screen everybody coming in with a spinal cord injury, even if the spinal cord injury was really low, and it wouldn't be anticipated that they would have any issues with their sleep. And sure enough, so many of these young men, that's the predominance of spinal cord injury is young men, engage in active sports, so you wouldn't expect it in this young population. They had the sleep apnea, they had the open mouth breathing issue, and the respirologist would come and talk to them about like, if we don't treat this, your risk of stroke, heart attack, dementia, high blood pressure, diabetes, like all high cholesterol, all of these things goes up because it's a strain on the system. It's a stress on the system every moment, every breath, and particularly at night when we're supposed to be rejuvenating in deep sleep.
Yeah, absolutely. And if you are somebody who uses a CPAP at night to help with oxygenation, if you have sleep apnea, these kind of exercises won't necessarily make it so that you don't need the CPAP. That would be a conversation to have with your doctor, but it would make the CPAP more effective because it opens up the airway. You can probably turn down the pressure. So it can be used in conjunction with other health practices that you already have.
Which is really cool, actually, because high pressure CPAP can be very annoying and loud, especially.
And then compliance doesn't happen because it's uncomfortable.
Yeah, you're less likely to use it. That's right. Yeah. Oh, that's so wonderful, Jessica. I think what we'll do is we'll wrap it up, and I think that was a really amazing like overview of the importance of the tongue. And I think the key takeaway is that what we covered quite a few signs that might indicate that you are having a problem with your tongue posture. And it's never too late. Like I'm in my early 40s and I'm treating it right now because I can see decades of benefit from this for me in the future. And I'm treating my children who weren't recognized early enough to identify the problem with breastfeeding issue, but we're recognizing hopefully early enough to allow proper bone and jaw development and proper nose breathing at night.
Mhm.
And that, by the way, if you go to your doctor, your regular family doctor, they will probably never have heard of this. This is not a mainstream field. It has its own research. There's research being published in its own journals, and that research is not taught in medical school.
Mhm.
So, you know how we say, like, you have to build your circle of care and identify where there are like weak chains in the link, and you want to buffer those chains and create a really strong circle of care. You keep attending your family doctor for the things that they can help you with, which is within their wheelhouse and their power. And you look for other people. And what we're saying is, perhaps the first kind of person you want to look for and reach out to is a consultation with a myofunctional therapist. And Jessica, I'm going to ask you to just share how people can find you and reach out to you if they want to delve into this further with someone like yourself.
Yeah, absolutely. The link is a little bit long, so I'm going to just drop it into the comments under this video, and that will give you the opportunity to be able to email me, and we can have conversations from there. So just put your email address and your name into the link that will be below. And I'm looking forward to talking to anybody who wants to geek out on this conversation with me.
Perfect. And I saw we have some people viewing today. Thank you so much for joining us today, ladies. You are sending us your love and appreciation, and we appreciate that deeply. And if you have any questions, please feel free to put it in the comments or reach out to Jessica. She's very passionate about this, and she loves talking about this stuff. We ourselves can spend hours talking about this. So thank you, Jessica, for joining me today. I so appreciate it. I appreciate you and your passion for helping people to live better lives, just feeling so much more, comfortable in their own skin. It's just such a beautiful thing to be doing. So thank you.
Thank you, Patty.
Bye.